Let me just introduce our presenters. Our presenters are going to be Pete DeLucia, who is Assistant Commissioner of the Bureau of Public Health Protection for Westchester County Department of Health, and also Hernani de Almeida, who is Deputy Commissioner of the Westchester County Department of Public Works. And my understanding is that, Hernani, are you going first or is Pete going first?
I'll be going first.
Okay, great. Thank you.
Okay, so I'll start my screen share now. I hope you can see this.
Bingo.
So I'm here to talk today. Again, my name is Hernani de Almeida. I'm Deputy Commissioner of Public Works and Transportation. One of my duties is to oversee the management of our facilities throughout the county. This includes our campus on White Plains, with several buildings there, the Valhalla campus, which has a penitentiary and a few ancillary buildings, and also several satellite offices, 6 owned buildings and 22 leased buildings. And under our management at DPW, we try to take care of the general public areas in the building. Specifically, I jumped ahead, specifically the HVAC systems, the common areas, cleaning, and general maintenance and repairs. So this fell in our wheelhouse to address when it became a return to work protocol. And I'm going to share with you guys today what the lessons we learned, what we found out, what you should be prepared for, and answer any questions you have that maybe we learned lessons along the way that we could share with you. So to start off, we're going to talk about our HVAC equipment. Generally, our HVAC equipment, if you have it in your school, some schools I know don't have it. They may have just ventilation or just air conditioning, heating, air conditioning, ventilation, whatever it may be, whatever combination. Chances are you have some sort of filter system in there. And filtration systems are rated in MERV ratings, which is, if you see here, whoops. If you see here, the minimum efficiency rating values. The state and CDC and ASHRAE, which is the engineering publication for mechanical engineers, all recommend a MERV 13 quality filter or better. What that means is the MERV 13 says you go higher in MERVs, the smaller tight knit that filter becomes. You have to be careful with your particular system not to go too high in a MERV rating because it may be detrimental to your system. When HVAC systems are designed, they're designed to have a certain amount of airflow through the filter, which designs the size of the fans, the size of the motors, the size of the ductwork, quite a bit of few things there. You may see other filter ratings out there other than MERV. You may find MPR, FPR, GRAB, and some other ratings. All those are resellers' versions of the rating. So the MPR is the microparticulate performance rating by 3M. The filter performance rating, which is the FPR, is a name came up by Home Depot. It really doesn't matter, but they all could relate back to a MERV rating. What we looked at when we first started this is perhaps retrofitting our systems with HEPA filters. Of course, HEPA filters are extremely tight-knit. They are usually designed specifically for medical institutions. And chances are your system cannot take the HEPA filter. It's highly recommended if you want to change your filters out in your building, if you're not already using MERV 13 or better. You should consult a professional, a qualified professional, whether it's a mechanical engineer, HVAC specialist, to come in and evaluate your system. Because even after they put the MERV 13s, let's say they say you can take it, you may have to recalibrate your fans and the pressure drops on either side of that filter so it moves air around the building in an efficient manner. Other considerations you may want to take a look at are UV light disinfectant. Now, we're reading different stories of whether or not it's effective. At first it was, then it wasn't. Now it's not again. It goes back and forth. What we did, just to be on the safe side, is we evaluated our system to see if we can take the UV filters. Now the UV filters, all they are tubes, long fluorescent tubes of UV light. And depending on the speed of which the air flows through the duct, it dictates the length of tube or light contact you need. So if it's going very fast through your ductwork, the light tubes have to be longer and you need more run in your ducts to install these light tubes. If you have a very slow movement, your light tube ductwork is going to be shorter. Again, it has to be evaluated by a professional. They'll tell you whether or not it's right for retrofitting in your facility, and you can at least have that in your back pocket with a quote, hopefully. And if it is finally determined that it is effective in an HVAC system, then you're ready to go. As far as cost goes, I should touch base on this. The MERV 13s, we haven't seen any price gouging on our end. They've been pretty reasonable with the prices. Filters are usually pretty cheap. We've had a little bit of issues with lead time, but it seems to be lessening now. About 2 months ago, we were having a lot of trouble with lead time. Now they're pretty much coming in within a week or two of us ordering them. So you shouldn't have any issues getting them if you haven't gotten them yet. But don't wait until the last minute because everybody else is going to be looking for them. Your preventative maintenance staff, while they may be a very good preventative maintenance staff with your changing the belts and the filters and checking out thermostats in your facility, you may not want to depend on them to tell you whether or not your system could take a MERV 13 filter. They may be very knowledgeable, but they may not be aware how the ventilation system works. There's a movement of air. Certain doors have to be closed sometimes so you can get the appropriate movement of air down hallways and through classrooms. So again, design consultants, mechanical engineers, and the repair guys that take care of these HVAC systems. We use Johnson Controls. They're pretty good. Those guys will be able to come in and evaluate your system with you. Fortunately, I have staff with qualified HVAC professionals that went to school for this kind of stuff, and they were on the ball as soon as this came out. The next thing we want to take a look at in our buildings are signs. Signage is a very important part of public education and almost public annoyance sometimes. What we try to do is put as many signs up as we can without over signing a building because people are just going to start ignoring it. So you want to be strategic about where you put your signs. Some offices are already going to have signs. Your main offices, your classrooms, the teachers are probably going to put up their own signs. As a facility manager, what we did is we focused, instead of the individual offices, we focused on hallways, restrooms, elevator lobbies, entries of the buildings, things like that, break rooms, cafeterias. That's where we focus because that's where our main responsibilities lie. And you don't want to overstimulate with an abundance of signs. You want to try and place signs relevant to where they belong. So if you're a hand washing sign, you want to put it near the bathroom. You don't want to put 30 signs as soon as somebody walks into the building, 1 or 2. You want to grab their attention, but you don't want to have them walk by with sensory overload. You can get signs where we got our signs for free from the CDC. You go to their website and you click on the More button on the upper right side. You can see it there circled on your screen, and then it'll drop down this menu and you go to Communication Resources. Once you click on that, it'll take you to another screen where on the left you'll see Print Resources, and there you have so many signs available. And these are the ones I went there, and in 10 minutes I was able to download these 10 signs quite fast and easily, just a quick anything that's related to schools. So you have a lot of things here that have kids in them. This is K through 12 stuff. And again, you may want to put hand washing signs near the bathroom. Symptoms of coronavirus, maybe put those in along the hallway here and there, and so on. And mask wearing, you may want to put that obviously you're going to want to put that at the entrance of your building. Speaking of signs, you can download them. You can print them on regular paper. What we did is we had a print shop put them on a rigid backing, and we hung them up. It looks a lot more professional. We went a step further, and we took one of their signs and we added our little logo to it. The great thing about the CDC signs is they come in both English and Spanish. So if you have a high Spanish population that comes to your school, you're going to want to probably mix them up a little bit of both. All right, and I would advise anything you put up in English, you should have it mirrored in Spanish right next to it. Barriers. Now, a lot of people want to have social distancing barriers. Barriers should be put in place whenever you can't meet the 6-foot separation as recommended. You're hearing it all over the news. Some people will want to have their own little private office, maybe even built up partitions. That's a huge investment. It takes a lot of time to figure out whether or not it's right for your application. You're going to need design professionals to come in. It may interfere with lighting, switch, electrical, fire sensors, HVAC equipment, and of course you have building code to tend with. Of course, you through the school system, you go through the state, but it's still it's a lengthy and costly avenue to go for a barrier and have somebody have their own personal space. So what you could do is a semi-permanent barrier, which you see there in the middle. That's a semi-permanent barrier that we put in one of our DPW office where we take in bid documents when somebody's bidding on a capital project for us. It's an aluminum-rimmed Lexan or tempered glass barrier. I don't know if you could see it, but in the center of the straight-on view, there's a transaction hole where people can send documents through. And through the side view, you can see it's a nice aluminum frame that's built on site. Now, these things get a little bit pricey. These are great for areas where you have high public traffic and you want them to come to one location and leave. It looks a little bit more professional. They're a little bit costly. They're around $2,500 each minimum. I've seen them go up from there. You don't want to use plexiglass or acrylic. That's flammable. So if you go with the Lexan or polycarbonate, that's not flammable. It'll burn, but it won't catch on fire. It'll melt, but it won't catch on fire like acrylic. But all of your glass installation or partition installation guys should know that and should warn you of that. But keep that in the back of your mind. Again, you may want to limit this to where you have high public interaction. On the right here, you have temporary installations. And these have been our go-to in the county. They're inexpensive. They could be moved around. They could be stored away when you're done and get ready for the next COVID or next whatever it is, Godzilla attacking or whatever. And then you can deploy these pretty quickly if you keep them in storage, of course. They're inexpensive. The only problem is that they're not appealing visually, but they do the job. They can be configured in many different ways. This company here that I'm showing is Louvers International. They supply Granger, which supplies the county, and they offer a wide-ranging. And this, I'm not pushing Louvers here, but I'm just telling you what we ordered. They offer a wide range of social distancing shields. You have here tabletop barriers, tabletop with bends, which you saw on the previous slide, cubicle extensions and hanging ones, which you may have seen at places like Dunkin' Donuts and ShopRite or grocery stores. Now, these barriers go for between $95 and $300. Very inexpensive considering the alternatives, right? And their sizes are wide-ranging, as you can see here. They can go from 24 to 47 high and up to 95 inches wide. So these sheets of Lexan, polycarbonate, are 47 by 95. Really, they're 48 by, I think, 96, and they cut them down. And they're highly customizable. They could put transaction holes. They could put no bends. They can, if you have an odd corner, they can bend it in 45-degree angles for you. It's extremely customizable. They don't usually charge for the customization. They just charge by the size, the general size. Again, we use Granger, state contract, and Louvers services them. They also offer rolling plexiglass. Again, I keep on saying plexiglass here, but you know what I mean, polycarbonate barriers here. And these rolling polycarbonate barriers are a little bit pricey. They're kind of like the nicer installations, but they can be transported around. This might be great in like a nurse's office if they don't have a specific setup to see children. And again, there's a lot of customization here. I just showed a few across the top that they can do, and those have to be quoted individually. Now, the lead time on these at one point were 10 days, and it pushed out to about a month, and I think we're back down to 10 days again. So there's peaks and valleys there with the demand. The best thing to do is identify what you need, the sizes you need, and contact a identified vendor that can give this to you. I'm sure you guys have your own sales purchasing protocols. Another thing you can do is use physical barriers. You don't necessarily need the plexiglass. The plexiglass is there for the less than 6 feet of interaction, distancing, and it shouldn't preclude you from wearing the mask. You should still wear the mask. It's recommended. But you could also use things like coffee tables and chairs with some yellow tape. That gives you your separation. And in any case, in this situation especially, people should still be wearing their masks. So do's and don'ts with barriers. You're obviously going to want to always keep 6 feet apart. You're going to install this when you can't meet 6 feet separation. The barriers don't preclude you from wearing a mask, so please continue to wear your mask. And if you could, if you're trying to have a barrier, let's say, for example, at a desk where people might approach from the side, you may want to put a barrier on the side to kind of a physical barrier, like another chair or something, or maybe mark the floor with some tape in front of the barrier so people know, even subconsciously, to stand on the marking and stay on the correct side of that barrier. I think people, society, are getting used to, when they go out to stores, being on the appropriate side of the barrier and facing the person correctly, but it should still be put there. Those markings on the floor, or some sort of barrier to direct the people in front of the social distancing shield. And you should also utilize the minimum amount of shielding needed to accomplish the task. Meaning, you don't want to take somebody in their desk and give them 360 degrees of barrier. You're creating a dead air space. And when you create that dead air space, it's worse for that person than letting the ventilation system do air exchanges in the building. Again, you want to be careful with your barriers and where you install them. You don't want to install them all the way up to the ceiling as well. Again, that'll block airflow. It may block fire sensors and cause issues. You may also want to keep them out of paths of egress during an emergency event like a fire. You don't want it to become a tripping hazard. So it should go up on top of desks. And of course, if you could avoid putting it on the floor. Next thing we want to go on to is cleaning. Now, as part of the facilities management, of course, you guys are probably all familiar with this. You have a janitorial staff, and you have a responsibility to the public to provide them with hand sanitizer. Most schools I've seen already have hand sanitizers hanging on walls, but if you don't, it's a tough market out there. We tried for about 2 months to try to get these touchless hand sanitizers, or even the touch version, and they were very difficult. We were finally able to get our hands on 200 of them recently, and I was later notified that Gojo, which is the maker of Purell, is now ready to supply in larger quantities to vendors and resellers. They weren't even taking our calls 6 weeks ago, and now we're getting calls from them that they could deliver in 7 to 10 days if we wanted to, and whatever quantities we want, hundreds. So I guess they took care of who they were trying to take care of, and now they're back onto municipalities and schools. So there's an alternative to the battery-operated touchless hand sanitizer, or the one with the lever, and there's the one all the way to the right that you see here, which is a foot pedal version. We have a few of these at the county, where you put a canister with the pump top on the top, and that little bar goes across the pump. As you press the pedal on the bottom, it pushes the whole bottle up and compresses that pump and right into your hand. You're going to want to use recommended disinfectants when you do this. Of course, anything alcohol-based is pretty good as long as it's over 70% of alcohol. And there's a whole list of cleaning supplies we'll get to in a minute. What you're not going to want to do is provide disinfectants in a spray version or chlorine where people are working with electronics. For that, what we did in our building is we took a package of alcohol wipes and we put them next to all our electronics. Reason for this, instead of going with some sort of chlorine-based disinfectant, it's because in an office environment, people will touch these wipes, they'll wipe down the copy machine, then they're touching their nice clothes, and it's getting bleached, and they're blaming you for it. So if you could get your hands on the alcohol wipes, again, these are starting to become readily available now. Luckily, for this going back to school initiative, things are starting to get back in stock now. We were having quite a difficult time recently. And again, 70% or better is what's recommended. And again, I use this for all electronics. We hand them to office staff and we put them by common stations like copiers. We try to do in our buildings, if possible, is minimize touch points by keeping doors open. Now, that could be a problem with your HVAC system. As I said earlier, certain areas in a building may be closed off on purpose because the HVAC is sectioned off and pressures have to be maintained to push the air to the returns and back through the filtration device. If you keep doors open, you remove those pressures that are needed, and that air starts to become dead. So be careful when you want to keep doors open. It's a good idea if you can. Be guided by what your HVAC people tell you, what has to have separation, what zones have to be separated if your system is designed that way. We keep our bathrooms clean about twice a day, at least twice a day. We have all our cleaning people cycling through our buildings, and they're instructed to hit the bathrooms twice a day and just keep on walking through the building, disinfecting common touch points such as railings, doorknobs, elevator buttons, go through the offices, even disinfecting break rooms, and again, going through copy machines themselves. You may want to follow the same guidelines. The CDC and New York State all recommend just do it as often as you can. And of course, do it more frequently where you have high foot traffic area. But they don't give you any guidance to what's the minimum number. So it's kind of like use your own judgment. And that's the judgment we use at least twice a day. And then at night, we give a deep cleaning to the bathrooms. As far as the disinfectants that we use, we try to use, well, we definitely use disinfectants that are listed on the EPA's List N. And the List N we'll get to a little bit more in detail before I finish my presentation. And Peter DeLucia will certainly touch base on what to watch out with those disinfectants and what to be mindful of. One of the things you're going to want to be mindful of is the contact time. Just because it's listed on the EPA's list of disinfectants that work against COVID doesn't necessarily mean as soon as you spray it, the COVID is dead. There's a certain amount of wet time it has to have, whether it's 30 seconds, a minute, 10 minutes. I've seen some of these things on the list need to be in contact for 10 minutes. And I'll show you a screenshot of that in a minute. The diluted bleach solution is highly recommended. It works well if you're in an area that, of course, you're not touching your clothes afterwards, like an office environment. Your cleaning staff can certainly use a bleach solution. That should really be done, the dilution portion of it, should be done by somebody who's responsible, understands what the dilution should be. They don't want to under-dilute it or over-dilute it. You don't really need much in a bleach solution to be effective. But it should be done by somebody responsible. It should also be done on a daily basis or as needed. You shouldn't stockpile a 55-gallon drum with this stuff. Some people may not know this, but chlorine has a half-life. Just think of it as like pools. After a while, it's just not effective enough. Usually after 2 or 3 days, you've lost a lot of its effectiveness. Peter later on, I guess, can elaborate more on that. He probably knows better than I do, but I know certainly in drinking water supplies, the 72 hours is usually the key point when chlorine has lost its effect for the most part. And you want to also be conscious about when you're using your cleaning products and where you're using cleaning products. You don't want to use them near children and staff. You want to make sure there's adequate ventilation depending on the product you're using. And you don't want to, obviously, overwhelm the students with those fumes. I hope I'm not going too fast, but I know I only have about 10 minutes and I have a lot to get through here. So I'm trying to get through this pretty quickly. So here are a couple screenshots of the EPA's List N, disinfectants against coronavirus. When you go to the EPA's website, you can actually just do a Google search for EPA List N, and this will pop up. It's probably one of your top 2 hits. And it'll take you right to this page. And it'll show you, as you can see on the left, a list of disinfectants, their active ingredients, their product names, who makes them, the contact time, and their EPA registration number. You can also export it to a CSV or an Excel spreadsheet. And that's what I did on the right here. You export it as a spreadsheet, and you create a table out of it. It's pretty simple if you don't know how to do it. And you can YouTube it. It takes you 5 seconds. You create a table out of this, and then you can filter the table. And at the end of this presentation, I'll show you how easy it is to get through this list of about 470 products that are available out there. So here's my contact information and a couple of links. There's Louvers International, which is the company that makes the social distancing barriers. The CDC's website is pretty simple, cdc.gov. And again, the EPA's list for disinfectants. You can easily just do a Google search instead of typing that whole long thing in for EPA list N, and that'll pop right up. Now, let me show you that list briefly. I don't know if you can see. Can you see this Excel spreadsheet that I have up? Or is it still showing the PowerPoint?
No, you're just showing the PowerPoint.
Okay, let me just reshare the screen. Maybe I just have to share, new share. Here we go. So you should see it now. Here's the list of your active ingredients. So you'll know right away if it's alcohol-based or chlorine-based, and your contact time. And the great thing about downloading this is you can filter this by contact time. Let's say you're not interested in anything with less than 1 minute of contact time. You shut off everything, just select one, and here just all of a sudden filters the 460 or 469 items to a handful that you can easily go through. And then over here, the formulation type, it'll tell you, is it on a wipe? Is it dilutable? Is it ready to use where you don't have to dilute it? You can, again, further filter it. So let's say you just want wipes that work in less than a minute. Here are all the wipes that work in less than a minute. Instead of going through the website page by page, this is an extremely valuable tool to use when trying to figure out what's the right disinfectant for you and your application. And with that, I'm going to leave it to Pete DeLucia, and he'll talk to you about the chemicals and cleaning protocols. Peter?
Annie, thank you very much. Lot to comprehend. I think you did a great job. I think you took your time on it. And once again, this is being recorded. And I see some of the chats coming up there, so it'll be available for you guys to take a look and get more of that information. If we can, you want me to try to throw up my PowerPoint, Joe, or you're going to throw it up?
I will do it when you give me the word.
Go ahead, throw it up there. I've got Kathy Teresi, my principal sanitarian, and I've got Jen Zagami and Matt Smith with us today on the call. If there's any questions that I can't answer, they're my support staff. They actually make me look good, so they know all the answers. So basically, what I'm going to try to do is I'll try to kind of go quickly over some of the stuff that Hernani actually covered already, but we can just go to the next one, Joe. Basically, what we always want to remind everybody is that, how COVID-19 is spread and why this is important is that it's respiratory droplets that are released when people are talking, sneezing, just going about their business, and it can get onto different surfaces. And that's what our concern is, because you can potentially get COVID-19 by touching those surfaces. So we want to make sure they're clean, because if you touch a surface that potentially has enough viral load and touch your mouth or your nose, you might end up contracting COVID-19. And it's also extremely important for the custodial staff to be cleaning for that purpose, but also to protect themselves when they're doing the cleaning. So we can go to the next slide.
There we are.
So, frequent hand washing, very important across the board. So we want to make sure that our custodial staff know that while they're doing the work that they're doing, they need to do frequent hand washing. And we also need to make sure that they're also, so they're doing it, sorry, Joe. Make sure they're doing the frequent hand washing, and that they're keeping the bathrooms at all times stocked with everything that needs to be there, with the soap, with the towels, and we'll talk about that a little bit more. They're required to wear their face covering at all times, okay? It's meant to protect other people from you. We've talked about that before, that by wearing that face covering, the general, surgical mask or the cloth mask is protecting other people from you, from your sneezing or coughing in case you're sick. We want to make sure that there's a sick policy in place, that you monitor absenteeism, and that the custodial staff know that if they're not feeling well, they need to stay home. They need to do this. They need to do the sick worker policy. They need to be familiar with it. They need to do the screening every morning like anybody else, even though they're coming in and doing the work. They need to be screened, and they need to make sure that they don't have a temperature and they don't have anything that goes along with no coughing, no sneezing, anything like that. So once they get that accomplished, they're out there doing their cleaning, and the priority has to be given to the disinfection of surfaces that are high touch, the very high touch surfaces that are throughout the school building. Your tables, your restrooms are a big issue, because we're going to be wanting the kids and the faculty to be going to the restrooms in those areas frequently to make sure that they wash their hands. So the faucets, the sinks, the door handles, all those areas. And make sure that you provide resources like this presentation to your custodial staff so that they're familiar with the things that, the health department's looking for, and make sure they're familiar with the plan that you put together and you submit to the Board of Education, so they know what the plan is and what they're going to be responsible for. We can go to the next slide. This is something which I mentioned already, but it's very important to continue to mention that screening questionnaire needs to be conducted daily for all of your staff, including your custodial staff. So whether you do an online screening every day, before you're allowed to report to work, and then that extra temperature check when they get to work, but that's very important. You can go to the next slide. So we talked about face coverings and wearing our normal surgical mask or our cloth face covering. In the case of custodial staff, there is going to be additional PPE that's going to need to be worn depending on the job they're doing. Just doing disinfecting and things like that, and dealing with whatever chemicals, like Hernani said about the bleach solutions and the people mixing bleach solutions or using other caustic solutions, you want to wear gloves. I believe the custodial staff are familiar with this. There are different types of gloves that are available that are even heavier duty for custodial staff. We'd like them to actually also have some other PPE, booties and gowns available for certain types of things. And we are highly recommending N95 masks, that at least a couple, so in case some of those custodial staff are not able to report to work, whether they're sick or they're on vacation, you have enough custodial staff that are fit tested and able to wear N95 masks, because they are going to be in a position, and we're going to talk about that a little bit more in my presentation, where they might be in need to clean up something that was from a suspect or a known COVID case. So in that case, we'd want them with an N95 mask, we want them with a face shield, we want them with gloves, with a gown. So you need to make sure that you have all those supplies and you've ordered them in advance, along with all the PPE supplies that you're looking for the school. Do not forget your custodial staff. Do not forget about getting them fit tested, and do not forget about making sure they have the appropriate supply. And I talked about this on the PPE presentation, and so did Christopher Locke, that your N95 fit test is for a specific mask. So make sure that you have enough of those masks that have been fit tested for those custodians so that they have them available. Additionally, when you're ordering supplies, once again, I'm glad that Hernani was saying that some stuff is becoming more available now, but there have been times where they're not very available. And with all these schools now looking at it, get on the list early and often to get your disinfecting products. Make sure that the products that you're using, and we're going to be speaking more about making sure they're the EPA certified products, but get on the list, get them purchased, and just general soap, paper towels, sanitizer, all of those things you're going to need, because it's so important for your bathrooms and for your hand wash sinks in your cafeterias and all to be properly stocked with the products you need. I cannot reinforce that enough, that hand hygiene is so important during this. And I am a huge paper towel fan. I've talked about this many times, and I'm not sure how many of the schools, there's been a big Go Green initiative, and you know what, thumbs up to that. But those turbojet dryers, any kind of dryer you hang on the wall, Dyson, they advertise, oh, these are the greatest things since sliced bread. No, they're not. They stink. No one keeps their hands in there long enough. No one ever dries their hands properly with them, and they wipe them on their pants, and they wipe them, and they leave, and they've just contaminated their hands again. Having paper towels, actually, if a child or anybody doesn't wash their hands properly, that extra wiping with the paper towels takes off the viral and bacterial load on your hands that you missed, and goes a long way. Also, that paper towel is available to shut off the faucets if need be, and open up the door and leave, or push the door open. So I would recommend to the custodial staff also to have another garbage receptacle outside that door, so that when the paper towels are used properly, to use it as another barrier to open a door, it's tossed into that garbage pail. Let's go to the next slide. Sorry, I'll wind up riffing on some of this stuff a little bit too long. what I really want to see is a log, something we look for when we do inspections for restaurants or places that we enforce. Is we look for a log. We look for a log for whether you've had your pesticide application. We look for cleaning frequencies in bathrooms at restaurants and things like that. So for the school, I'd highly recommend that you have logs so that they have the date, the scope of the cleaning, and what's been disinfected. So you know if something's happened or whatever, you can go and you can see the last time the staff has been there. And as Hernani correctly stated, there's no hard and fast rule on how many times you need to sanitize during the day. What you really want to make sure you do is those high traffic areas as many times as possible. We've done big norovirus outbreaks, which kind of go in, that are like COVID a little bit in these nursing homes and assisted livings. And, we have them continually, you're sanitizing. And as soon as that area is done, another couple hours, as you do the whole facility, you're back to that point one. Elevator buttons, touch screens, if touch screens are available, banisters, anything that you potentially high traffic, especially the door handles, the doorknobs and things like that. Anywhere in a school where, it still meets fire code and meets all safety regulations, where you can leave doors open so that people don't have to be constantly opening and closing doors. That's one less touch surface that all these hands are going on. The other thing is, school's not in session right now, a big cleaning of any visible soil and debris before sanitizing. You've got to clean before you sanitize. It's not really one step. If surfaces are dirty and have soil on them and you're just sanitizing, you're not getting the bang for your buck. Things need to be cleaned with soap and water and cleaning products first before you do your sanitizing. Next slide. We've mentioned this before. We'll continue mentioning it throughout all of our presentations. When you do disinfecting, you have to make sure you use the EPA approved disinfectants. When you use EPA disinfectants or anything, the label is the law. So the label on that product, you have to follow that, and that gets you out of trouble of mixing things that aren't supposed to be mixing, not doing correct dilutions and things like that. And I know a lot of schools, they don't necessarily do this themselves. They'll contract out to different firms that come in to do their cleaning, or they'll contract to a firm to do additional cleaning, maybe overnight or things like that. Make sure you have that in your contract and that you have proof that they're using the EPA's list of approved disinfectants. There's a lot of new stuff out there. There's a lot of things that I know Hernani talked about UV. Some people, oh my God, UV is the answer. And you start reading some articles on UV, it looks great. Then you read another set of articles that UV does nothing. And then it's so confusing right now, and everybody's trying to get their foot in the market to try to sell a product. Only the stuff that's been vetted out by the EPA is the stuff that you should be using. And it's tried and true. Go with that stuff. Once again, we're reiterating the fact that the custodial staff, when using these products, they have to use the correct PPE, and the label will have that on it too. But we're always recommending at least the gloves and some sort of mask and all, not to inhale the fumes and all. And a lot of times, some of these products, depending on how they aerosolize, they will recommend the N95 mask. Now, we touched on this before, contact time. Contact time is extremely important. A lot of people like to spray and wipe and move on. Many times the spray and wipe, you've just wiped off what you've done, and there hasn't had enough time there to be a kill or to deactivate what's there. So know the contact time of the sanitizer. The EPA's got, and it was great the way, Hernani, I'm really happy that you were able to show how you can actually use that Excel file and knock it down. And it shows right on there your contact times that you need to do. And we always say in the health department, let it air dry. That's the best thing. Have it on there, let it air dry. If you're able to do that, in some surfaces you might need to dry it. You don't have the time to let it air dry, but most you do have the time to let it air dry. So then at least you're getting that full sanitizing. Next slide. I wanted to go over how to prepare sanitizing solutions for different events. Look, I pay a lot of school taxes, and a lot of these products are a lot of money. Bleach is cheap. Non-scented bleach is a great sanitizer. I love the smell of bleach in the morning. I tell you, it's great. I have no problem with it. It's good stuff. You don't have to overdo it, that you're knocked over by the smell when you walk into the building, but a little smell of bleach is good. And I have to tell you, from our norovirus and flu and a lot of outbreak investigations we've been doing over the years, since schools have gone bleach-free, they've gone up. because bleach is a great sanitizer and it does the job. And a lot of these products that you guys have been buying that are green do not kill TB, therefore they do not kill norovirus, and they're not going to kill COVID, and they don't work. Bleach is cheap and bleaches work. Get someone who understands how to mix those products. As her nanny said, do not let them sit for long periods of time. Do not mix up tons of 55-gallon jugs of them. Doesn't make sense. Mix up enough what you need for the job for the day, and then do it again, because they will lose their efficacy, depending on how they're stored in many different factors. I don't even have to worry about it. Mix it up for the job. It's safer that way also than mixing up these giant quantities. For food contact surfaces, basically that's for your kitchen, your cafeteria areas where you're going to have food contact, even toys and things like that for little ones with the pre-K and K and all that. It's really 1 tablespoon of unscented bleach, and unscented is important. We only want to use unscented bleach to a gallon of water. That's the dilution. It is an extremely low dilution. You're not going to get a smell of bleach with that. It's just going to be barely enough. It's going to do the job for food contact surfaces, as long as those surfaces, once again, have been cleaned first. Now, for your non-food contact surfaces, and most of what your custodians are going to do, which is basically the doorknobs, the toilet areas, the sinks, all that kind of stuff, is 1/3 of a cup of bleach to a gallon of water. That's all it is. You let it air dry, 1 minute contact time. That's all it is. Nice and simple. Put it down, let it air dry, walk out of the bathroom, and you're good to go. Now, for the significant viral load, for a vomit or a fecal event, which could happen. You've got a child that's sick. It's probably, knock on wood, it's not COVID, but they vomit in the hallway, they vomit in the bathroom, they have diarrhea, it gets all over the place in the bathroom, whatever it is. God bless the custodians that have to clean this up and our nurses that do this work and everything else. They're going to have to do it. At that point, 1 2/3 cup unscented bleach to a gallon of water. So that is something you're gonna get a bleach odor from that, but that's what you need to do to be able to clean that up. Next slide. And believe the next slide should go with how to proceed with that cleanup. There's where we're talking about the PPE on your custodian. You're using an absorbent material, paper towels, disposable cloths to actually clean up the solids first before you're sanitizing. Once again, you have to clean, right? So you need to clean all that up, put it in a double plastic bag. Never use a shop vac, never. And I bring that up because why would I use a shop vac? Well, people have. That's why I brought it up. We've done investigations and we had norovirus blown through an entire assisted living facility because they thought it was a great idea to go with their shop vac and start sucking up all the vomit on the floor in this one room. And that's what happened. So, it's lessons learned. And we always in our presentations make sure you do not use a shop vac to clean up any kind of biohazardous stuff like that. Just it aerosolizes everything and causes a major problem. So we'll go to the next slide. Talking about our custodian now again doing his work, having to go start cleaning up everything. N95 mask, that's what we really want to see with that. Their gloves, protective clothing, so they can dump all that when they're done. Section off that area that the event happened, whether it's the bathroom, that's easy, the nurse's office, the hallway, make sure we've got no kids tracking through it or anything like that. It's sectioned off so we can do the adequate cleaning. They're cleaning up that debris first. Someone's talking in the background. Cleaning up that debris first to get with the absorbent material. Then all the soiled items, we're double plastic bagging to minimize any aerosolization. Then you're literally using your disinfectant to clean that area that was contaminated. Plenty of time to air dry, give it that contact time. We're using bleach, so as long as we cleaned it correctly, it's going to still be that limited 1 minute or so contact time. Then got to actually doff, as if anybody watched the PPE presentation we did yesterday, Chris mentioned the word doffing, which is when we're taking off PPE, we don it and we doff it. So we're correctly doffing it, taking it off and putting it in our bag, and we're double plastic bag, and we're putting it in a trash. Carrying it in the trash to limit any time that it's getting bounced around. If we have it, we're talking about the software. We went back, Joe. You got to go. Somebody's not on mute that's bouncing around. What's going on there?
I'm going to mute everyone and then unmute you, Peter. Where'd you go?
Thanks, Joe. Joe, if you go forward.
Yeah.
And we talk about thoroughly washing our hands after we've done this. We've completed the whole cleanup of this event. You have to make sure you thoroughly wash your hands. Once again, 20 seconds, sing that happy birthday song to yourself twice, really, really thoroughly getting it in there, and then properly drying those hands. Next slide is going to talk about, we're going to go now on to, God forbid, we've got carpeting or upholstered surfaces. If we've got carpeted or upholstered surfaces, it's a little bit more difficult job to do. You've got to remove that visible debris the same way, but then we're involved with, you're going to have to hire a steam cleaning company or have a steam cleaner to really clean that carpet. And what my big recommendations right now about that is, if there's carpeted areas that you can get rid of, that would be a plus. And also any chairs and things, first and foremost, as you're laying out your facility now for return to school, we don't want congregation, right? We're going to be keeping some way, somehow into pods and things like that, classroom. So we don't want seats all over the place. So, you know, back in the day when I used to get detention at Roosevelt High School and I had to sit in those chairs outside the principal's office, you know, only kidding, I never got detention. Good kid. But I remember the chairs were all lined up there. Some of them all had cushions on them. You don't want that. We at the health department got rid of all of our chairs that have any kind of upholstery on them. We put them away for later use in the future. Use those hard plastic chairs so they're easy to clean. And don't, once again, they have to be at least 6 foot apart and don't have them all over the place. We don't want people congregating. We touched on this before, different products new to the market. They're excited about UV. They're excited about, you know, different kind of ionizers and this and that and all that stuff. Some of them are good, but check that they're on the list or check that the product that's used. There's a lot of these now, you know, electrostatic sprayers and all. Just because it's an electrostatic sprayer, it has to be using the proper product to be able to do that, whether it's bleach-based, if it's quat-based, if it's, you know, depending on what it's based, check on that EPA list, make sure it's effective and approved against COVID-19. Keep your code-required ventilation at all times, especially when you're doing the cleaning and all. If windows can be open when the janitor's in rooms and things like that, we want to keep the airflow going. And Hernani really did great on talking about dividers and putting different things up. Be very careful with that. On the surface, it looks really good, but if you could have the separation, the mask wearing, the things like that, I would limit the dividers. You really need to contact your building department if you're going to be putting any permanent type of dividers or things like that in place. You want to be very careful about that. And the heights of them, people want to build these you know, basically make cubicles around people and areas and kids. You don't want to do that. You want to keep the airflow going and things like that. It's very important. If you have any questions, you can always, you know, take a look. There's a lot of good information out there. You could reach out to the health department. I mean, just as far as even just working with the food service and with the restaurants, you know, we talked about having the distance between the back of the chair, the 6 foot distance to the table. But, you know, if you're in a booth, you don't have to have the back of that booth go up to the ceiling. It's 5 feet is basically off the floor is the measurement right now. So, you know, you don't need to have these higher things. And especially if you're looking at tables in a cafeteria or things like that, as long as we're dining in pods and we're keeping, you know, people together, just like we've been doing with our children's camps right now, you don't need to have that additional separation. But I think that's the end of what we put together. I tried to go through it a little faster because we're already getting close to 3 o'clock, and I'm sure there's going to be a lot of questions. And my PowerPoint, along with Hernani's PowerPoint, will be available. You know, there's a lot to cover on these topics. But, you know, if a couple of things, you know, I made sure I emphasize is that hand washing for your custodial staff, for your teachers, for the kids at school, that's so important, along with the mask wearing to protect other people from your germs, and for the custodians to protect them from the chemicals and the other viral and germ load that may be in the atmosphere when they're doing their cleaning, enhancing it to an N95, and keeping the distancing. And that could include not only, you know, separating things out, using, you know, partitions and things only where appropriate.
Thanks, Pete. I'm just going to run a couple of quick questions by you. There are a number that came in, but as I generalize them, there are a number of questions about specifics of various requirements for various things, from hand sanitizers to plastic separation to those kind of things. Where is the best place to identify what would be the um, the materials that would meet what's in the requirements? Is there, I mean, do we have a list that we've made available? How would that work?
I guess we could both, I'll let Hernani answer as far as the dividers and stuff like that, but really the CDC has got a lot of really good information on their website regarding the strengths of the alcohol-based sanitizers, regarding cleanup with chlorine products, with the mixtures that I went over today. Waiting to see. I know the New York State Association of Health Commissioners is working on some guidance documents. There's a lot of people working on guidance documents right now, but the CDC is probably one of your better resources for looking at actual, numbers as far as concentrations of different types of things and sanitizers and all that. I mean, Hernani mentioned 70% for alcohol-based sanitizers. It depends on the type of alcohol. Some can be 60%. I think it's the difference in isopropyl or not. And all those commercial Purells and things like that are generally good. The New York State sanitizer is 70%. I think it's isopropyl. And I know that I think Jim mentioned on the call yesterday for PPE, one of our people that procure stuff in the county, New York State is looking at a contract overall for hand sanitizer. So that would be something, maybe a New York State sanitizer that you guys could get your hands on. But I think the touchless sanitizers are so important too. If you could have those stationed throughout the school building, and maybe even a pump sanitizer. I'm going to talk about this in a few minutes. I'll mention it on my cafeteria presentation. I like the idea of if you're going to have kids dining at assigned seats and tables in your cafeteria, a sanitizer right on that table. So the kids, before they eat, when they didn't wash their hands properly because they had other things to do, like my daughter texting and things like that, they're going to actually use the sanitizer, hopefully, and be reminded to do that. But I digressed on that. Hernani, you have any suggestions?
Yeah, well, again, going back to the list of chemicals and things, we have to go and clean on that list. And but a few things about requirements have to do with New York State building codes, and the school system is regulated by New York State building code, not local. So you're not going to go through your local building department. You're going to go through New York State department. So any questions having to do with whether or not something conforms to code, you may want to get a design professional involved and speak to your state building code enforcement agents. There were a couple of specifics that were brought up with certain sections of the code about what does it say about spacing of sanitizers and things. And that was a good point, because there is a section of code that says you can't have sanitizers any larger than, I think it's like half a gallon or something like that. It was something huge, because you don't want to have so much alcohol, it's flammable in a hallway, right? But most of these hand sanitizers are not going to hit that quantity. And then it also says something about how close they can be. They can't be any closer than 48 inches. Well, you're going to have these things spaced out around your building, so chances are you're not going to violate code anyway. But if you're really that concerned about meeting code, certainly you can look it up. It's free to look up online, the New York State building codes, or you can consult the professional who will certainly guide you in that and charge you for their time. And then there was also a question about the bringing in outdoor air when you have a system that brings in 100% of outdoor air and exhausts it again. It doesn't recirculate. There are a few systems out there that use 100% outside air. They're extremely, extremely inefficient. They are energy monger, like really soak up a lot of energy. So a lot of the newer systems don't have that. And if you have that system, then hey, your filtration is mostly to take out the pollen and the dust coming into the building. This is not going to help you for COVID, this filtration. But if you have a recirculating system in portion or otherwise, even if it only takes, if it takes 50% of outside air and recirculates the other 50%, you're still going to want to have these MERV 13s. And then there was one last question about bipolar ionization systems. ASHRAE actually put out a notification about bipolar ionization, and they said that there's not enough research on that yet. And again, going back to what I said earlier, ASHRAE was the publication for mechanical engineers and professionals. they put out a notification that there's not enough research in that field to justify some of the claims yet. So I wouldn't, going back to what Peter was saying earlier, there's a lot of new products out there. Just because they say they work, don't believe them. Go back to the CDC, ASHRAE. You can contact us, and I'll be happy to give some guidance as well.
Okay, Deputy.
We don't know, we'll
on that one,
research
I'm
it.
sorry, Pete. I'm going to have to end this here because we have the next workshop starting in about 1 minute. So, like I said, we will be editing this down into a webinar. We will be putting it up. It probably won't be before the end of the week. But keep in mind, our goal here is to help all of you meet your requirements, first and foremost, for the plans that are due this week. After the end of this week, we will be able to spend more time helping you effectuate your plans. So again, thank you all for joining us. Thank you all for your presentations, and I'm sure we will be speaking together soon. Thank you.